at a workplace, so I must sensitize you. What are the stresses at the workplace? Something called rudeness, bossiness, and aggressiveness. It is one of the common stressors which we have come across. Uh, Believe me, this kind of behavior, being aggressive, being rude, or being a very impolite towards your subordinates, actually is not going to increase the productivity of any company, right? The another stressors are the red tapeism, strong, strict rules, deadlines. There was a survey which we did in the armed forces. When the feedback from most of my patients were deadlines, that we all work under deadlines. Apart from these, the source of events or social events like birth, death, promoted, not being promoted, conflicts, interpersonal conflicts, and marital discords. These are the common life event stresses which I am witnessing in Dubai in my short experience of 1 year. Among these four, the most common is marital discord as well as financial stresses. These are two common stress in this part of the world, right? Okay. Life stresses. What are the life stresses which actually disturbs? We, if you consider yourself to be stressed, then you have to find the source of stress, from where exactly the stress is coming and challenging you. So you have to sit back, do some introspection, and find out where exactly is the stress. Most commonly, there are four domains on which the stress starts. One is the work related, interpersonal relationships, financial worries, and fourth, internal fears of being perfection to reach zero error. That is one. These are the four situations where the most of the stress germinates or evolves. Right? Let us be specific about some recurrent stresses. If you are working in a workplace and you are witnessing toxic relationship, being overworked, or lack of boundaries, then you have to solve that. Examine your, as I already said, examine your internal conflicts. How, where are they arising? Self doubt, being perfection, unresolved old traumas, that also causes a chronic stressful condition in any human being. Ask yourself what thoughts or beliefs is coming to your mind or is actually disturbing you. Prioritize it clearly and then sort it down. If it is a financial instability, you must acknowledge that it is a stressor and it is disturbing you. Now, how can we maintain our mental peace? It is very easy to say, but very difficult to practice. Believe me, I am practicing psychiatry for around close to 2 decades, and still I'm not a perfect person who is able to manage stress, because we are trained for treating the stress related disorders. But when I was going through the literature, I came that these are the few of common ways with which one can achieve a mental peace. One is mindfulness and meditation. Practice mindfulness and say to yourself, stay in present. In Hindu mythology, Lord Krishna also has said, Vartaman, try to be in present. Secondly, practice some deep breathing in between. 5 minutes of inner, 5 to 10 minutes, you have to practice the deep breathing. I'll explain in the later half of the presentation how do you practice. The deep breathing stimulates a vagal nerve in the body, and which calms you down under by the neurotransmitters. There are some apps available now, like Headspace and Calm, which are commonly practiced by the youngsters these days. Another way of looking stress is to reframe it. How do you reframe? How do you see your stress? Like a glass is half empty or half fully filled. Whenever there is a stressful situation, just look down or look it into it and tell yourself, I can't handle this, is one way of telling to it. Another way of telling to yourself is, this is tough, but yes, I have overcome these kind of challenges before. So in short, don't underestimate your own self. You are capable, you are something who is unique in this global world. You have a DNA which nobody else. You are the unique person, you are the best person. Try saying this intermittently to yourself. Okay, then practice gratitude daily. In the first moments when you get up in the morning, I am sure most of you must be picking up your phone, and instead of practicing gratitude, just believe me that more than we all who are listening to the presentation, we are among the lucky 10 to 20% of the people across the globe who have 3 meals, a stable job, a shelter, a family. The current global condition with floods, with wars, with inter conflicts among countries, we are the lucky ones. So we must practice three things in the daily life. Then this kind of a thought, positive thought, also counters the stress of set boundaries in your life. Try to say no to non-essential commitments. I know this is not a forum to say, to teach or to preach, to say no, but you have to prioritize your commitments, and you have to accept that this is not in my frame, my uh, capabilities. Limit your exposures to negative influences, especially the social media. Organize your social media, reduce your comparison. Excuse me. The You must have seen, we all post positive things of life on the social media, and hence once we open a social media app, we tend to compare ourselves with our buddies, with our colleagues, with our subordinates, and try to compare our lives with them. We must There was a study done uh, in by journal. It's a journal of medicine. There was a study that the happiness improves if you abstain yourself totally from the social media. Try to restrain it, try to practice it. Believe me, it works. Avoid listening to excessive news which are disturbing. But what can we do? These days disturbing news are common. Try to restrict it. Build a support system if you have. Uh, I know it sounds a little silly, but spending time with your family, with your parents, with your wife, children is therapeutic. It lifts up your mood, builds up your confidence, and I'm finding this a main reason for these days, because we are no more joint families. In the in older days, in there was a concept called joint families, when the stress was shared by the people of the family. But now nobody can imagine that kind of family organization. We have nuclear and subnuclear families, and hence the stress is increasing in the society. Sharing your struggles with your family members, with your mentor, or with anybody whom you trust is a practical solution to the stress. Uh, this is an important slide because it shows the physical health vis-a-vis mental health. It has been found that 30 minutes of walking daily at least can improve your mental health by improving your good hormones in the body. And yoga, any kind of movement, sitting on a chair for continuously for 45 minutes or more than that also hampers or also it disturbs your body neurotransmitters and increases cortisol, which is a chemical in the body responsible for stress. You must have noticed these days a lot of pot-bellied men. This is actually because of increase in the cortisol levels, which are the manifestation of chronic stress. Exercise can be as effective as an antidepressant. Last but not the least, 7 to 8 hours of uninterrupted sleep prepares your mind and body to handle stress in a better way. Accept yourself. Happiness can only exist in accepting yourself in the way you are. Believe me, you are the best. That you keep telling to yourself that you are the best person to handle the stress at this particular moment. If this because stress is a global event now, you cannot avoid stress, but you are the best. Okay, use stoic principles like focus on what is in your control. Don't blame yourself for something which you have not done. Believe me, a guilt or a self blame unnecessarily increases your stress levels tremendously. This was a good slide which I picked up from the net. Whenever you're given a project which is huge, which is magnanimous, which appears to be a big thing, divide it into small steps and handle it in stepwise manner. Okay, similarly that you can manage any financial stressor also. Create a budget, consult a financial advisor. Long-term practices of stress management is develop self-compassion, as I already told you. Treat yourself with kindness. Believe me, your body, your heart, pancreas, and important body structures, they also face stress more than you. So respect your body. Avoid doing self-criticism. You have you are doing good. You have done excellently in the conditions with which you were. Pursue meaning, engage in activities like your hobbies. I'm sure people who are listening to this lecture or presentation must have had hobbies once upon a time. Open those hobbies, sketchbooks. I'm sure sketching, gardening, singing, writing, playing a musical instrument. Try rediscover those activities and learn from your past challenges. When to seek help? This slide is for me actually. When is my role? What or when to seek a psychiatrist? If you feel that stress is unmanageable or the mental peace remains disturbed for a chronic period of time, which is reflecting on your family and your occupation, both fronts. I'll give you an example. For example, a patient of alcohol dependence syndrome who is excessively indulging in drinking and not able to handle his family, his parents, his children, he's abusing his family, and the next day is not able to perform well in his office needs a psychiatrist. If a person is depressed, sad, not able to sleep properly, not able to manage, concentrate, focus, needs a psychiatrist. Okay. So always believe it's okay to be not okay. Therapists or counselors, they also can help you, but they are not the treatment. They are the part of treatments. They teach many therapies like cognitive behavioral therapies or supportive psychotherapies, but they are not the holistic treatment. The doctor who is dealing with psychological imbalances or emotional disturbances is a psychiatrist. So never hesitate to approach psychiatrists. I know it is a stigma to consult a psychiatrist, but believe me, it is no more like that in Western educated world today. Support groups are there online, like schizophrenia, alcohol anonymous frame. There, these are the communities one can join and share their thoughts and experiences. Now, as I was talking about deep breathing, there is a concept called 478. Uh, try to inhale for 4 seconds, hold your breath for 7 seconds, and exhale it again for 8 seconds. If you can do this for 10 minutes to 20 minutes in between your work, it improves your focusing, relaxes you, and reduces the stress at least temporarily for the time being. Reason being, by deep inhalation, you are stimulating your vagal parasympathetic nervous system, and hence your BP goes down, your cortisol level goes down. Okay, ground yourself, some distract yourself by 5 4 3 2 1 method, by imagining four things which you can touch, three things you can hear, two things you can smell, and one thing you taste. This is a kind of distraction. And last, take a break in between. Step away for 10 minutes or so after every long meeting or session or discussion, which is involving more than 30 minutes. All right. Now I'm coming to the last slide before the discussion. What is a take home message? Take home message is stress is inevitable. Stress is a universal phenomena. It is your mental peace, which is a skill you have to build up gradually. One must practice mindfulness, boundary setting, and self care to handle the stress. Start small, be patient, and remember that peace is a process and not a destination. And finally, if you are not able to handle the stress, and please report to a psychiatrist. Don't feel hesitant. When to seek a professional psychiatrist's help, when to come to me, when you have a prolonged insomnia, you are not able to sleep properly, you have an interrupted sleep, when you have a change in appetite, you are excessively hungry, you are not able to eat, you have temper issues, you have an increased irritability, you are struggling to get out of the bed because of persistent sadness of mood, you're not able to focus. This is commonly seen in adolescents and young adults, commonly called as ADHD. A loss of sexual desire or a drive is again a very important criteria for a underlying psychological disease, commonly depression. Depression causes lack of sexual drive. Also, alcoholism produces nearly zero sexual drive, leading to marital discord and others further consequences. Thoughts of suicide or self harm or this kind of a behavior which is very common these days among young people. I have seen being suicidal, young students doing self harm. Generally, they are into drugs or alcohol or self medication. Thank you very much. I've come to end of the discussion. I'm open to the questions. If you have anything in your mind, you able to, yeah, are you able to to hear me? Yeah, are you able to hear me? Hello, are you able to hear me?
Yes, doctor, we can.
Yeah, I have just finished the presentation. The next part is I would like to ask, I would like to answer any questions, uh, if at all, from the audience. If there is any questions, I would like to answer that. Mr. Ashwin V. Kumar, would you like to ask any question? Mr. Vishnu Manohar, any question from your side? Sir, I would be more than happy to answer. Mr. Mohammed Zazil, any questions? If shall I conclude the presentation, madam? Are you able to hear me? To hear me? Hello. Any questions? If you, I'm more than happy to answer it. Mr. Manuel is asking, how can we manage the toxicity at the workplace? Uh, Well, I'm not the person who can answer this, but I'll try. You see, there are some people who are toxic by nature. There are some personality disorders, especially borderline personalities, paranoid personalities. They are not so pleasant to be with. Try avoiding them. I know many times it is difficult to avoid them because you have to work with them. Try not to take their comments personally, seriously, because they are not only toxic to you, but they are toxic to a large number of people. So try avoiding and minimizing your interaction with them. If it is becoming unbearable, you can approach your administrative administration. If they are also not doing, try shifting your job place. We can hear you. Mic is disabled. Am I audible, madam? Now am I audible? Okay, some new message. We cannot ask doctor online. How? Hello, doc. Can I ask you a question related to patient? Psychic. A patient is diagnosed with tactile hallucination described with risperidol, but the family is reluctant to give this medicine. No, 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 no. Risperidol is very, very safe medicine if it is prescribed by a psychiatrist in the correct dosage. You should tell your family not to hesitate, but to start, because hallucination is a very disturbing condition for the patient. tactile hallucination is a very common manifestation among drug addicts, especially cocaine, cannabis, and other drugs. If the patient is having tactile hallucinations, you must treat the patient. And my advice is a risperidol is a perfectly safe medicine. Is a perfectly safe medicine. Am I audible to you? Sir, my problem was in sleeping. At the time of sleeping, I just overthink for my family and myself, too much headaches after I can't sleep. Then I play games and sleep 4 5 hours. You see, Mr. Vishnu, your problem is called as insomnia in technical terms in psychiatry. Insomnia is managed without medications by things called sleep hygiene. You have to stop using all kind of gadgets for 1 hour before going to bed. If you are indulging in playing games, you are using a lot of your brain in in those games. So you should stop doing practicing playing games and trying to sleep. Those two things are not possible simultaneously. It's like pressing accelerator and brake together. However, if you are thinking too much about your family and yourself, this reflects that there must be some problem in your family. Try to focus, pin it down, which problem is there in your family. And if it is there, which is manageable, you can manage at your end. But if the sleep is a persistent problem, you must visit a psychiatrist, uh, because you are also mentioning about headaches. Headache can be a manifestation of other illnesses also. I think it's the family choice now. You can, okay. How to handle anxiety, frequently getting panic attacks, feeling breathless and heart beats fast. Is there any medicine I can take? Yeah, then Danya, it's a very common feature. Believe me, since the time I have come to Dubai, I've seen most cases which are anxiety and stress related. You see, anxiety is a psychological condition which is called, if I frequently get panic attacks. That means you are having episodic anxiety. You're feeling breathless because you are having tremendous increase in the anxiety. Now, is there any medicine? Yes, medicine is there, but uh, if you want to take it on SOS basis, you can also take it on SOS basis. I can prescribe you. Those medicines are controlled medicines and can be available only on the prescription of a doctor. But if you are having frequent panic attacks, I would prefer you to consult to a psychiatrist, because panic attacks can be due to hypoglycemia also, due to heart related conditions also. So first report to a general practitioner. The doctor will refer you to a psychiatrist if you are anxious, or you can come directly to a psychiatrist. That's not a problem. And don't feel hesitated, don't feel stigmatized. If it is if this condition persists in your life, then you may land up in a heart illness, diabetes, high blood pressure. That is because stress is the most common causes of these conditions. I hope I have answered your question, Dania. I can't prescribe the medicine in an open forum like this. It's a yeah, okay. You doctor, how can I maintain my personal life and work life together? My work pressure is affecting my life, personal life, every night at the time, every night at the time of my sleeping, my mind full of the next issue. Mr. Ashwin, this is a problem in this new age when we have WhatsApp, we have mobile, our life is there is no boundaries between your office life and in your life and your personal life. The moment you open the door of your house, immediately a message comes from your office that you have to submit this project, that project by you have, and you are given some task. So the work and the personal life boundaries are getting dissolved. It's a very, very common issue these days. To be very frank, I I I'm managing my personal life in a 60 to 40 manner. 60 to 40 means 60 I give to my personal life. I'm a very selfish person, believe me. And I give 60% of my life to my personal life, my family, my children, my health. I give 60%. The 40% of the my attention remains on my work schedule. To be very, very honest, I have not prepared any kind of lecture in today's presentation. Now, every night at the time of sleep, your mind gets full of next day thoughts. That means you are anxious and worried. I advise you that you should note it down on a diary. What kind of work schedule, what kind of thoughts are disturbing you at the time of sleep? Sort it down, write it down before going to sleep. And once you are in the bed, don't think about anything else. Try to do that. If you are not able to do, you will require a medical support. But believe me, try to manage life in this way. Also, exercise regularly. If you exercise, your sleep quality improves. Exercise 30 minutes every day, not for your physical body, but for your mental health. Okay. So, this is the best answer I can give you, Mr. Ashwin. I would like to add also that if you experience that any person near you, any family member, any relatives, any colleague who requires psychological help, then he or she should be referred or at least suggested to seek medical help because you can save a life. Believe me, I have lost uh, few of my close friends who have committed suicide because they were not timely referred to a psychiatrist. And you can save a life, you can save a family. So don't hesitate in going to a psychiatrist. That is the biggest hurdle which stops us means from the Indian subcontinent, Asian especially, developing countries. There is a big stigma consulting a psychiatrist. Believe me, a 10 years time period goes before a person seeks a medical advice. provide your contact details for those who are interested. Then someone please provide your details. Okay.